Quality of life measurement in NET patients utilizes EORTC questionnaires. Hello, this evidence-based content is prepared by Saboor Khan, fellowship-trained consultant surgeon, and if you or someone you care about has been diagnosed with a neuroendocrine tumor, you're in the right place. I know that beyond simply surviving this condition, you're wondering how to actually live well with it, how to track the symptoms that truly matter, and how to communicate what you're experiencing to your care team. But today we're going to explore something crucial: how quality of life is measured in NET patients, and why these measurements matter not just for research, but for your day-to-day care. By the end, you'll understand what the EORTC questionnaires are, why both generic and NET-specific modules exist, and know exactly how these tools can help you advocate for better symptom management. For example, if you are receiving a somatostatin analog, a synthetic protein similar to somatostatin, used to treat certain hormone-related conditions and tumors, it's essential to track how well it's controlling symptoms like flushing or diarrhea. Or, if you are undergoing peptide receptor radionuclide therapy, a type of targeted radiation therapy used to treat certain cancers, particularly neuroendocrine tumors, monitoring your energy levels and pain is crucial. Even something like your Ki-67 index, a marker used to measure the growth rate of cancer cells, influences decisions about treatment options. Quality of life in neuroendocrine tumor patients isn't just a medical concept, it's your lived experience with this disease. While NETs often have better survival rates than many other cancers, patients frequently live with their disease for extended periods, making quality of life a crucial measure when considering care. Somatostatin analogs are synthetic hormones used to manage symptoms of neuroendocrine tumors. Peptide receptor radionuclide therapy is a type of targeted radiation therapy that delivers radiation directly to tumor cells. While considering treatment options, your Ki-67 index, which is a measure of how quickly cells are dividing, is also an important factor. The European Organization for Research and Treatment of Cancer developed a core questionnaire called the QLQ-C30, which became the foundation for assessing cancer patients internationally back in 1993. Think of it as a baseline health inventory: physical health, psychological state, social relationships, and personal beliefs. But here's where it gets interesting. Generic cancer questionnaires alone aren't comprehensive enough for NET patients, because these tumors present unique challenges that differ significantly from other cancers. Pancreatic neuroendocrine tumors may only present symptoms of the hormones secreted, without any generic cancer issues. This is why measuring quality of life in NET patients requires evaluating issues relevant and important specifically to them, as opposed to relying solely on general cancer questionnaires. This instrument was designed for use in international clinical trials and assesses 30 core items across multiple functioning domains. What does this actually mean for you? It measures your ability to perform daily activities, your emotional well-being, your social functioning essentially, the universal aspects of living with any cancer. The QLQ-C30 gives researchers and clinicians a standardized baseline, but it's only part of the picture. The EORTC QLQ-GINET21 module was designed to be used alongside the QLQ-C30 questionnaire, specifically to assess quality of life in patients with gastrointestinal NETs. It was fully validated and published in 2013 on behalf of the EORTC Quality of Life Group. This module captures what makes your experience distinct, the disease-specific symptoms and concerns that only NET patients truly understand. Quality of life encompasses a multitude of facets including physical health, psychological state, social relationships, and personal beliefs. Thus, many aspects of a disease affect quality of life, making assessment essential for patients living with disease, especially for prolonged periods. The GINET21 module was developed through extensive patient and healthcare professional interviews to identify what truly matters in day-to-day living with gastrointestinal NETs. Here's something that might surprise you. These aren't just items on a checklist, they're the symptoms that can completely reshape your daily existence. For gastronoma patients, diarrhea was reported in 16 separate studies, with 8 studies showing that more than half of patients experienced this symptom. That's not a minor concern. That's a life-altering issue affecting work, travel, and social activities. Flushing, particularly in carcinoid syndrome, is reported in over 90% of cases. It's described as dry flushing, an intermittent or persistent sensation of warmth together with skin erythema, usually involving the head, neck, and upper torso. Pain assessment captures abdominal pain, which, in non-functioning pancreatic NETs, was the presenting symptom in 6 out of 10 papers where more than half of patients reported it. These scales allow you to quantify experiences that are otherwise difficult to communicate. How many times? How severe? How much does it limit you? The functioning domains assess something equally important but often overlooked: your capacity to live your life. This includes physical functioning. Can you carry groceries, climb stairs, care for yourself? It includes role functioning. Can you work, manage household tasks, fulfill family responsibilities? Emotional functioning asks about anxiety, depression, worry about the future. Social functioning examines whether your condition interferes with family life and social activities. Cognitive functioning addresses concentration and memory. Why does this matter? Because disease control rates and progression-free survival rates are important measures of treatment benefit, but quality of life measures are also important. You're not just trying to stop disease progression. You're trying to maintain the aspects of life that make it worth living. For someone managing symptoms while trying to maintain employment, knowing that 80% of similar patients report similar challenges validates your experience. Here's where it gets really interesting for your care. Clinical trials historically focused almost exclusively on tumor response rates and survival, but quality of life instruments have transformed how we evaluate treatments. In the NETTER-1 trial examining peptide receptor radionuclide therapy, researchers didn't just measure progression-free survival. They measured time to deterioration of diarrhea in patients with carcinoid syndrome. Peptide receptor radionuclide therapy is a type of targeted radiation therapy used to treat certain cancers, particularly neuroendocrine tumors. The median time to deterioration was significantly longer with treatment and standard dose octreotide compared to high-dose octreotide alone. That's measuring what matters to you. How long before your symptoms worsen? Quality of life data helps distinguish between treatments that might have similar survival outcomes, but vastly different impacts on daily living. If you're supporting someone through this, understanding that trials now routinely collect this data means you can ask, which treatment gave patients better symptom control? Which one preserved functioning longest? It's empowering information. The Social Security Administration, a U.S. government agency that administers social programs covering disability, retirement, and survivors' benefits, has a listing for carcinoid syndrome. Peptide receptor radionuclide therapy, a type of targeted radiation therapy that delivers radiation directly to cancer cells, is a systemic treatment. Several factors predict the success of PRRT. The Ki-67 index, a marker of cell proliferation used to assess the growth rate of cancer, is a measure of cell proliferation. These questionnaires serve another critical function. They give you a structured framework for communicating with your healthcare providers. Much of the literature on NET symptoms is a combination of clinical observation and repetition of anecdotal historical observation. There are few papers systematically asking patients to record and score their symptoms. This means your subjective experience might be dismissed or minimized, unless you have concrete ways to express it. When you complete these standardized assessments, your responses become part of your medical record, not just doctor observations, but patient-reported outcomes. Patient-reported outcomes are reports coming directly from patients about how they feel or function in relation to a health condition and its therapy, without interpretation of the patient's response by a clinician or anyone else. This shifts the conversation. Instead of "I'm struggling," you can say, "My diarrhea score increased from 12 to 23 on the symptom scale, and my social functioning domain dropped 15 points. That's data your team must address. If you're worried about someone you love who has difficulty articulating their experience, these tools provide language and structure to capture what words alone might miss. So here's your bottom line. Let's talk about the 3 categories of action. First, ask your oncology team whether they use specific questionnaires or similar patient-reported outcome measures in your care. If they don't routinely use them, request access. Many centers now have digital platforms where you can complete these between visits. Second, if you're considering enrolling in a clinical trial, specifically ask whether quality of life is a measured endpoint and request to see previous trial data on symptom outcomes, not just survival statistics. Third, start tracking your own symptoms independently using a simple journal. Rate diarrhea frequency and consistency daily. Note flushing episodes with timing and triggers. Score pain on a 0 to 10 scale. This personal data complements formal assessments and helps identify patterns your team might otherwise miss. Come to your next appointment prepared with these questions. Are there NET-specific quality of life modules appropriate for my tumor subtype? Remember, there's consensus from patients and NET specialists that the QLQ-GINET21 is not comprehensive enough for pancreatic NET patients specifically, and modules are being redeveloped for specific patient groups. Ask, how do different treatment options compare in terms of quality of life outcomes in clinical trials? Request, can we establish which symptoms should be measured and tracked systematically as part of my care plan? And critically, if my quality of life scores deteriorate, how will that influence treatment decisions going forward? These questions signal that you're an active participant in your care, not a passive recipient. Consider participating in quality of life research if opportunities arise. Patient and healthcare professional interviews across many countries are being conducted to collect more data on quality of life issues specific to different NET subtypes. Your participation helps future patients. Additionally, if you're supporting someone through this journey, recognize that quality of life assessment includes you. Caregiver burden and family impact are legitimate concerns worth measuring and addressing. Finally, understand that as presentations, symptoms, and treatments evolve, so do quality of life measures. The issues patients face have altered due to changes in disease presentation, symptoms, and management approaches. Staying informed about updated modules ensures your experience is captured by current, relevant tools. Let me quickly recap. Quality of life measurement in NET patients combines generic cancer questionnaires like the QLQ-C30 with NET-specific modules that capture unique symptom burdens, diarrhea, flushing, pain, and functioning domains that measure your capacity to live fully. Your next step? Request that your clinical team incorporate systematic quality of life assessment into your care plan. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. The EORTC Quality of Life Group continues to develop and validate disease-specific modules, and the NET Patient Foundation provides patient-centered information on living with neuroendocrine tumors. Full links are in the description below.